Why don't we go next to Chelsea from Wisconsin? Chelsea from Wisconsin, welcome to the David Pakman Show. What's on your mind today?
Hi, David. Can you hear me?
Yes, I can.
Okay. I'm just gonna straight read something that I wrote because I will mess it up if I don't do that, okay?
Okay, no problem.
All right, I have two questions about health insurance. So, first of all, I worry all the time about what will happen to the insurance provided on the marketplace with Obamacare. I have a lot of health conditions, and without that insurance being available and the tax credits, I would get very sick because I wouldn't be able to afford insurance. Which, by the way, I have to disagree with you that the insurance is terrible. It's definitely not the best, but I think it could be worse. And if you're lower income, you get the subsidies,
So
which is
there's
super
two different
helpful.
things here, Chelsea. So
Okay.
this relates to something I said the other day about the plan I get from the New York State Health Connector.
Yeah, you were
The
complaining about
plans,
it.
the plans I have access to because I don't get a subsidy are really expensive and mediocre. Separately, blue states, including Wisconsin, New York, Massachusetts, and others, for lower income folks who get free or dramatically discounted plans, the plans are often absolutely fantastic. So there's two different things there, and my plan is a different type of plan. So you're 100% correct there.
Okay. Okay, I got you. My question is, so you talk about Trump and DeSantis and their non-existent health plans, but what are like the real world possibilities that I should actually be worrying about that could actually happen and maybe prepare for and not just
Okay.
worry about this existential threat to my healthcare?
This is a great question. Okay. And part of my ability to answer this will be limited by the fact that I'm not as familiar with Wisconsin as maybe you are. But this is a great question because it's practical. Okay. Let's imagine somehow Trump wins and, quote, gets rid of Obamacare and doesn't replace it with anything. Now, Chelsea, it's possible Trump will get rid of Obamacare and replace it with something that will give you some benefits. We don't know. It's possible Trump will fail to get rid of Obamacare, but let's imagine he gets rid of Obamacare and puts nothing else in its place. What will happen will depend on what your state has in and of itself. So I'll give you an example. When I was growing up in Massachusetts, we already had something called Romney Care. And so when Obamacare came in, Romney Care already met all of the requirements of Obamacare. And so essentially nothing changed. And if Obamacare went away, not much would change. Some of the funding sources might be realigned, around the edges, something might change. But so that's an example where from everybody in health policy I've spoken to in Massachusetts, if Obamacare went away, in Massachusetts, nothing would change. So the first thing to find out is how tied to Obamacare is Wisconsin's plan that you are a part of. If it's not
Got
that tied to it, very little might change for you, okay? Part of this has to do with what's called the Medicaid expansion that's part of Obamacare. There's all sorts of specifics. So the way I would be thinking about it, Chelsea, is I would want to know in Wisconsin, before Obamacare, what was available to people in your exact situation. Once you answer that question, then you can think about, okay, what would I do in that scenario? But in your state and in many blue states, it might not be as bad as some people are worried it would be.
Okay. Okay, awesome. That I will look into that. And
All right.
then, so my second question is a little, it's about Medicare for all.
Sure.
So from what I understand, from if you do Medicare for all, everyone's taxes are going to increase. But wouldn't everyone then not have their regular monthly premium?
Yes.
And I can't imagine that taxes would increase more than what people are currently paying for their monthly premiums. So wouldn't everyone be saving money and why isn't everyone for this?
This is an exactly correct way to approach this. If you install Medicare for all and say that it's going to be a system that is paid into, you would be paying something, but then you would no longer have copays, health insurance premiums, coinsurance, all of these different things. The exact numbers are the source of some debate, right? Bernie Sanders, for example, looked at a 4% income-based premium. And if you compare that for households making a normal income versus what they currently spend on premiums through work, plus copays, plus everything else, they would end up saving some money. Not everybody would save, but a lot of people would. This is the idea of it. Now, there are people who will say, you know, you don't even really need to add a 4% tax because you can actually just reorganize spending from other areas. Okay, well, so that's one approach. There's others who say 4% isn't going to be nearly enough, or you're going to need to pay the 4% plus keep paying some kind of copay or whatever the case may be. But the bottom line is Medicare for all would lead, if you do it through a tax, it would lead to some increased tax for some. It will lead to savings in another side of the ledger for some, but you would, on balance, increase the efficiency of the system dramatically. You would eliminate the need for people who have no primary care to go to the ER for primary care, which is really expensive and it gums up the system. There would be all of these other intangible benefits as well, and you're thinking about this exactly the right way.
I don't understand the people that are against it. It just seems so clear cut to me.
I mean, listen, it does to me too, but there's a lot of people that think differently from us.
I have to be misunderstanding it because it just seems so clear cut. So, okay. Yeah. Thank you for explaining that.
Chelsea from Wisconsin, thank you so much for the call. We're going to go to a break. We will be back after this, and we will take live calls again. Fear not.